Another technical issue is that if you are experiencing any delay, a lack of synchronization between the image and the audio, it will help a lot if you will close other windows and applications on your computer. We found that that really makes a big difference. So I think we're just going to give welcome one more time, and then we'll get started. It's about 6 minutes after 1 on my clock. So those who have just joined, welcome to our live web-based discussion. Today, in this Talking Biopolitics event, David Winickoff will be interviewing Dorothy Roberts, and then we'll be taking some of your questions that we'll invite you to send us at any point, actually, using the Q&A function at the right bottom of your screen and sending those to Emily Batics. You'll need to select Emily Batics on the little drop-down menu there. And if anyone is having technical issues, and I'm going to give Emily Batics' phone number one more time in case you're not seeing it on your screen. She can help you with technical issues, and her cell phone is 510-502-8733. So let's get started, and I'm going to just give a few introductory remarks. I want to let you all know that today's conversation is part of a series that we've launched that we call Talking Biopolitics. And this is a series of web-based conversations about the social meanings and implications of human genetic and reproductive technologies. Our aim, our objective for this series is that we hope that these discussions will help us all think more strategically about how to bring our shared biopolitical concerns to a broader public, and how to get our ideas about addressing the concerns that we have onto the policy agenda. The topics that we'll be talking about today, and an array actually, of related topics, will also be addressed at the Tarrytown meeting this summer, the 3rd annual working meeting that we call the Tarrytown Meetings. They bring together advocates and scholars who are working toward a biopolitics that's really based in social justice and public interest values. And if you'd like to find out more about the Tarrytown Meetings, you can go to the Center for Genetics and Society website and just search on that phrase, the Tarrytown Meetings. So a number of people on this call have attended the Tarrytown Meetings or other CGS events in the past, and others of you heard about this event from colleagues with whom CGS has been in touch, and we welcome all of you. We're really delighted that you're all here. We launched the Talking Biopolitics webinar series last month with a conversation with Bill McKibben, the widely noted and I think one of the most effective campaigners, grassroots campaigners for policy to address the threats of climate change. And Bill McKibben also has written a book, a wonderful book, about human biotech issues called Enough: Staying Human in an Engineered Age. The next scheduled Talking Biopolitics event is coming up next month on May 8th, when UC Davis law professor Lisa Ikamoto will be talking with award-winning author Harriet Washington about her new book, which is called Deadly Monopolies: The Shocking Corporate Takeover of Life Itself and the Consequences for Your Health and Our Medical Future. So we'll be sending you more information about that event so that you can register for that. So I'll be turning it over to David in just one more minute, but before, and he'll introduce Dorothy, and then ask her some questions, and then we'll be asking you to submit your questions using the Q&A function at the bottom right of your machine. And the last thing before I turn it over to David is to introduce him to you. And so David Winickoff is Associate Professor of Bioethics and Society at the University of California at Berkeley. He's a graduate of the Harvard Law School, and he writes about biological resources and property rights, especially regarding biobanks and human cell lines, also the role of scientific experts within legal institutions, and the politics of risk assessment, food safety, and climate change. He's a former Greenwald Scholar in Bioethics. He helps direct the Berkeley Science, Technology, and Society Center. He serves on the governing council of the Science and Democracy Network, and it's my pleasure to say that he also serves on the advisory board of the Center for Genetics and Society. So with that, I turn it over to you, David.
Thanks so much, Marcy, and thanks for hosting us today. And thanks to the whole audience out there. This is exciting. I've never done this before, but it's very exciting. Today, it's my great pleasure to be speaking with Dorothy Roberts, the Kirkland and Ellis Professor of Law at Northwestern University. Professor Roberts has written more than 75 articles and essays and authored or co-edited 7 books on a wide range of topics, including race, reproduction, criminal justice, and child welfare. She also serves on numerous boards of organizations dedicated to advancing health and social justice, including Center for Genetics and Society. Her latest book, Fatal Invention, How Science, Politics, and Big Business Recreate Race in the 21st Century, was published in July 2011 by the New Press. Dorothy Roberts, thanks for speaking with us today.
David and Marcy, it's good to be here.
Well, in my bioethics class, Dorothy, I put up a quotation by Craig Venter, one of the 2 major sequencers of the genome as part of the Human Genome Project, at least one of the 2 major ones in the United States. And so he and Harry Collins both stood up behind Bill Clinton. And Venter, as you probably know, said something like this. In fact, this is a direct quote. "We have sequenced the genome of 3 females and 2 males who have identified themselves as Hispanic, Asian, Caucasian, or African American. We did this sampling not in an exclusionary way, but out of respect for the diversity that is America, and to help illustrate that the concept of race has no genetic or scientific basis." So, as you point out extremely well in your book, there's such a central message coming out of our science leaders at the very top that says the Genome Project has revealed that we are the same. We're 99.9% the same. And yet, as you illustrate in your book so well, somehow, just as much, or perhaps hearing more, that in fact there's the opposite effect, that somehow people now are focusing very much on that 0.1% and talking about race in genetic terms. And I wondered, can you help us understand why that is? It just seems so stark, that comparison.
Yeah, there is this weird paradox that when the Human Genome Project confirmed what evolutionary biologists and anthropologists and sociologists and historians and other geneticists had been saying for decades, that race is not a natural division among human beings. It cannot be identified at the genetic level. That it seemed at that very moment was when we saw this resurgence of interest in gene-based variation along racial lines, or race defined as a biological category. So, for example, just a year after that statement by Venter, which was repeated by Francis Collins and repeated by President Clinton, Nicholas Wade wrote an article in the New York Times identifying as the next stage of the Human Genome Project the issue of genetic differences between human races. This was published in the New York Times in 2001, and he accurately predicted, I think, what many genomic scientists then pursued, this fascination, this obsession with trying to find race at the genetic level and also explain health differences, health disparities, inequities, other gaps in welfare among people along racial lines by genes. So your question was why? Why would that happen? I think part of the reason why it happens is because the notion that human beings are divided into biological races is deeply, deeply, deeply embedded in our science, in our culture, in our politics. It's been embedded in the United States since the very inception of this country. It's a founding principle, you could say, in law in the United States. And biologists who are studying genes aren't immune from that upbringing and what they're taught in school, including in medical school. Students are still taught to this day that that's one of the first things you identify about a patient is what race they are, and that is significant to their diagnosis and treatment of disease. So I think it would be naive to think that just because someone's a scientist, they haven't learned this false view of humanity that we're divided into biological races, even though, as you point out, and as I document and others have, that has been firmly discredited. But then there's also other incentives. There are financial incentives, both from government funding agencies and private commercial firms and enterprises. So the NIH, for example, requires recruiting human subjects by race, but also in some clinical trials, actually reporting results by race. There are some exceptions, but some researchers believe that they have to, in order to get NIH funding, divide their results about biological aspects of their research subjects into race. And then there is the whole new enterprise of race-specific pharmaceuticals, other kinds of therapies and products, including race-specific medicine, which can provide a way of getting patent protection and FDA approval, and the FDA has already approved a race-specific drug for self-identified African-American heart failure patients. And Jonathan Kahn has shown a huge increase in the number of patents that rely on race to make genetic claims about products. And so there is, I think, an increasing financial incentive to do research and produce products that incorporate this false assumption that race is a biological category. And then there's also the fact that if you believe race is biological, it's a very handy way of explaining why we continue to see huge gaps in health, wealth, welfare, education, incarceration rates along racial lines in a country that's supposed to have done away with racism and that many people think is post-racial. And so believing that these differences, these gaps come from innate biological difference is a way to explain away the continuing social inequities that exist in this country. So I think for all those reasons, I think it's hard to pinpoint one, but I think all of those are converging right now. This is a political moment, I think, where this kind of thinking can become popular again, which I think is one of the reasons it's so dangerous to perpetuate this myth of biological race.
So let's maybe drill down into one of the cases you talk about in your book, and you just referenced it now, and it's this case of race-based pharmaceuticals. And one of the things that is, I think, so difficult here is that we see operating what Martha Minow has called a dilemma of difference, by which she means that on the one hand, we want to recognize the inequalities that occur in society by categories, certain of these pre-existing social categories, and to remedy those explicitly on the one hand, and yet on the other hand, somehow we want to do that without somehow essentializing difference as being sort of a constituent of people somehow, that to recognize categorical difference in the social world carries this danger of reifying difference in either the biological world or in other, some other kind of social reality. So I think we saw that with as you mentioned, with BIDIL and the pharmaceutical, where we had these Office of Management and Budget requirements to report out the effects report out how drugs affected people by race, to make sure that certain groups were included in clinical trials. And then somehow on the other effect, it plays into the propagation, the markets, the patents, to then, out of this alchemy, create an African-American pharmacy. But is that dilemma something real and difficult to parse out? Because it is difficult for me to parse out.
Well, I think it really helps if you understand what race is and what race isn't in getting through that dilemma. Because if you are clear that race is not a biological trait, that it is not a natural division of human beings, it is a political system of governance that divides people up into invented categories that are based on, again, invented biological determinants, among other ways of identifying who belongs to one race or another. But all of that is created, it was created historically to justify slavery and colonialism, and continues today as a way of governing people. It's not inherent. It's not written in our genes. So if you understand that, then it's easier, I think, to understand why it's important to include a diverse range of people in research, and to make sure that all people have equal access to the benefits of research, and that all people are protected against the harms of exploitative research, without then thinking that requires that you divide up all therapies, all results, all prescriptions, all diagnoses according to these social categories of race. So I understand the tension that came out of having to argue you were different in order to be included. This is what minority groups felt they had to do to get the attention of federal funders and others, to say we're not like white people who have been the standard for medications and drug development. We're different, therefore we need to be included. Unfortunately, that was the message of biological difference, instead of a message of inclusion having to do with social justice and equal access to the benefits of medicine. But I don't think that arguing for the justice of equal access and also arguing for equal protection against exploitation, I think it's important to add that, because it's not as if Black people were left out of medical experimentation. Blacks were often the victims of unjust and unethical and barbaric medical experimentation. But the argument was we should be included in the benefits, but you don't have to believe in a biological distinction in order to make that argument. I think that we could want to have medical research that appreciates the diversity of human beings without categorizing them by race. I think this was one of the very, very unfortunate turns that was made after the Human Genome Project, where at that point there was the potential for a new science that relied, on the one hand, on our common humanity, on the unity, genetic unity that was discovered that you referred to originally in Craig Venter's statement, and others made that point as well, but at the same time also recognized the vast genetic diversity that came out of the Human Genome Project and subsequent research without relying on this archaic form of categorizing people by race. Instead of doing that, many people have continued to feel compelled to use race in their research instead of using their scientific imagination and doing away with these obsolete categories that come out of the 17th and 18th centuries. It just, to me, astounding that scientists cannot think of a new way of doing research on human beings that does away with those false classifications, at least false in the sense that they're not natural biological classifications, and think of a new way of understanding how genes operate in human beings, and also a new way to capture the vast diversity among human beings, which is not boxed into the social categories of race.
Do you have hope that as we move to a whole genome and integrate whole genome sequencing into the clinic, if that ever happens, are you hopeful that that might be a way to bypass race as a kind of shorthand for genetic difference towards the kind of idea that, you know, Harry Collins has been putting out for some time, that the gold standard really will be diversity and individual SNPs, and we won't need race?
Well, I don't think we need race as a biological category now to do the research. So you might ask, waiting, you know, for routine whole genome sequencing, why don't we just do away with it now? I find it very strange, this excuse that for some reason scientific researchers and drug developers have to use race as a crude, inadequate proxy for genetic variation because they're incapable of doing the research otherwise. I just don't accept that argument, but I understand that that's a very common argument made. It was an argument made in support of BIDIL, the race-specific heart therapy, that race was being used as a surrogate or a proxy for some unknown genetic difference that explained why this drug worked on certain people. And it keeps coming up as an excuse to continue to use race. So as to your question, well, once there is the cheap whole genome sequencing that can be done on every patient, will we then finally do away with race? Well, I don't think so, number one, because as I said, we know enough now not to have to use race. We know how unscientific it is as a proxy for genetic variation, yet it's being used by many people, many scientists and others. And also, again, because race is not a biological category, doing away with its use as a biological category is still going to preserve the political system of race. I don't think that genetic testing is going to undo the political system of race. I think that we have to continue to engage in a political struggle to dismantle the political system of race. And this is one of the problems with the emerging racial science, is that it pretends that we can use genetic technologies as a quick fix for many of the problems like health disparities, like inequities in criminal justice, like the effect of the slave trade, doing away with historical records so that African Americans can trace their ancestry back to tribes in Africa. All of these issues that are a result of racial oppression and racial inequality, some biotech industries and scientists are saying, well, genetic testing or some genetic technology can solve the problem. And I think that really ignores the importance of political organizing and a political movement to undo racism and the systems and institutions in which racism is embedded. That can't be fixed by a genetic test. It requires sustained movements that have a much broader effect on our society. And believing that either race is a biological category, or that genes can tell us everything about ourselves and knowing more about them is going to solve social problems, I think that those are misunderstandings of what it will take to achieve true racial equality in America.
Dorothy, you mentioned back at the beginning of the interview the frustration perhaps that you had with the reporting on the genome, Nicholas Wade and others, and it's certainly a theme in your book. And as you just were saying, of the need to engage politically, to dismantle race, and to engage critically with science, do you feel that, as it's set up currently, that there are enough good media outlets to help us understand, for the public and the politically active to understand science? Or how do we engage or improve media to do the kinds of important biopolitical work, if you want to put it that way, that needs to get done?
Yeah, well, I think there are some outlets that are doing excellent work in this area to things about race and genetics, and also to inject a political consciousness about what's going on, like Biopolitical Times, Color Lines, the Applied Research Center's online magazine, and others I could name are doing a good job. I think, though, that mainstream media, like the major newspapers, television, broadcasting, many of the major blogs are continuing to perpetuate this idea that race is a biological category. They often report on very shoddy research that claims to show that race has been discovered at the genetic level, or that there is an African gene or Hispanic gene for a particular disease. These kinds of studies tend to grab the headlines, and people believe these headlines without going back and reading the study and questioning whether the study really establishes some of these claims. So, for example, in January, on the front page of the Science Times, there was an article about genetic adaptation of slaves that once they reached the New World, that through natural selection, African Americans became predisposed to certain cancers and cardiovascular disease. And this got even a picture of slaves working in the field and headline about natural adaptation. If you go back and read the article, there's no evidence in the article that this form of strange, natural selection to be prone to heart disease and cancer happened so quickly among African Americans. And there were lots of flaws with the study, and yet it got a headline, and people read this and think, oh, that explains why Black people have high rates of hypertension. Their ancestors, for some strange reason, adapted to the New World to be genetically predisposed to these. So these kinds of studies grab the headlines, grab people's attention, and I think there is a real need for the mainstream media to get it right and to and not to be so quick to publish studies that are based on such shaky evidence, and to understand better the meaning of race, and also to be more willing to publish articles that contest this notion of biological race. I haven't done a study of it, but just from my very careful reading of newspaper articles, especially in the New York Times, there seems to me to be many of these articles that claim evidence of a biological meaning of race without a similar attention given to those of us who are contesting that meaning and pointing out the dangers of continuing to perpetuate that meaning in racial research and biotech and pharmaceutical products.
I wanted to just address the audience for a moment. So please send in, we're receiving questions actively now. There is a Q&A box in the bottom of the right corner of the window. So please send those in, and I can then relay them on to Dorothy. I will take one of those questions now and pass it along to Dorothy here. The audience member asked, you're a writer and a scholar, as are many of the people on this call, and many of the participants in the Tarrytown Meetings network as well. You're also deeply involved with advocacy work. Could you tell us about what you've learned, and tell us about how and why to combine scholarship and activism?
Well, I have found that I was going to say scholarship without activism is dead. I'm thinking of a quote from the Bible, faith without works is dead. That just came to my mind. I know you shouldn't say things like that on a live webinar, but I do, seriously, I feel that I cannot be a good scholar without also being an activist and engaging with other activists, because I believe that, first of all, my purpose for doing scholarship is to try to contribute to better conditions of equality and justice for people in the United States and around the world, however I can possibly do that. And I can't know the best way to do that if I don't engage with other people who are advocating for the ends that I share, both because I don't think I can be effective, and also because I can't understand the issues I'm writing about and the consequences of my writing, the social and political implications of my writing, if I don't engage with people who are thinking about these issues as well and working actively to achieve the kind of justice that I also want to achieve. So I guess in short, I'm saying I think my scholarship is more effective if it can be useful to people who are spend more time than I can as activists, but also I don't think I would be informed enough to write on these issues if I didn't get their input in what's important, what's the effect on people's lives of the issues that I'm writing about. And so I just think, to me, it's not just an obligation, it's essential to my scholarly work. Was there, I somehow think there was another part of that question that I may have forgotten.
Oh, I think that covered it. I mean, what, in practical terms, what does that mean for you? Does that mean that you are hanging out with activists and talking with them, working on boards and organizations? Does it mean taking your work public? And I know you go on some programs and you think carefully about bringing your work to media outlets and that sort of thing.
Yeah, it means all those things. So I am trained as an attorney. I even have a license to practice, but I could represent people. I found that what I think is most effective for me that I have time to do, I'm kind of overwhelmed because I'm involved in more things than I can handle, but what I found most effective for me is being on boards of organizations whose missions I believe in. So I'm chair of the board of the Black Women's Health Imperative now. As you mentioned before, I'm, along with you, David, on the advisory board of Center for Genetics and Society. I was on the board of Generations Ahead, whose mission was to bring more voices into the discussion about the implications of genetic technologies. And I also try to be involved in public agencies that are grappling with these issues. So I'm on the Standards Working Group of the California Institute for Regenerative Medicine, for example. And then I also try to work more informally with organizations who are seeking to achieve social justice, but especially in health, the area of health, reproductive justice, and genetic technologies. And that may just be attending meetings, phone calls, reviewing documents, that kind of thing. But I also try to, as much as I can, do public speaking in a variety of venues, so not only on university campuses, but events sponsored by public interest and social justice organizations, bookstores, other venues where, and public events where I can share my ideas and the information I've been able to gather and engage with the public on these issues. Also, you know, radio, television, to the extent it's available, I leap to opportunities like those.
Right, and the occasional video conference. So I have a question, though, about this. What about the reception? So, I mean, I'm just curious about the reception, not so much within the community of activists and folks that you work with, but what about when you put these ideas out into the world, whether it's on the working group standards at CERM here in California, or whether it's with federal agencies, or even when you go on mainstream TV. Is it difficult to communicate your ideas and to have them be taken up, or what's been your experience?
Well, it's mixed. From people who are very enthusiastic about what I have to say, very, very supportive. I've spoken to large audiences that, you know, have cheered when I spoke. I've also spoken in medical schools, for example, where I've gotten an icy reception and challenges about the ability of researchers and doctors to treat patients and develop drugs without using race. So I've found that this isn't among all doctors and researchers I talk to, but many are resistant to the idea that we can give up the use of race as a biological variable in research. many I found hold to this idea that race is a useful proxy for genetic difference because there's nothing better to use, and so it's beneficial to use race. I mean, when I was on the Tavis Smiley show, for example, and people wrote comments online, there were a few people who said I was doing a disservice to patients because I was blaming doctors for using race, and race is a good tool for more accurate diagnoses and treatment of patients. So I find that idea, and it's not just doctors, there's also people in the broader public who believe that about the practice of medicine, and so that's a very common response I get. Although I have to say I also just the other day received a really nice email, and I've received others like this, but there was one that I thought was, that gave me hope from a reproductive scientist who heard me speak at a public forum and said that she hadn't thought about the political and social implications of using race as a biological category. And once, as she thought about what I said, she had to agree that race is often used in a very sloppy manner and uncritical manner in scientific research. And she also mentioned the dilemma that you pointed out about wanting to give more access and to diverse groups of people, and not reinforcing the idea that these groups are, especially that racial groups are distinct biological entities. But I thought it reflected an openness of some scientists to think critically about how they've used race in the past. And I think it's also important to note that there are many, many, many scientists who understand the invalidity, the scientific invalidity of using the social political category of race as if it were a genetic category. It's not as if this is a uniform view of science. There's a debate within science as well, and I think it's important as we talk about engaging with various organizations and publics, engaging with scientists whose authority is very often taken as the gold standard for answers to these questions. And I think I don't think that they should have the only authority on this, but many people do see them as having the greatest authority on these questions. And so it's very helpful when they come out and confirm that race is not a genetic trait.
Great. I've gotten a couple of other questions that I want to relate to you. One is around how race might be discussed outside the U.S. So one person says, race is often discussed in U.S.-centric frameworks. What is your view on countries such as Japan, which are far more biologically homogeneous, which insist on clinical trials conducted with, quote, Japanese people for drug registration?
Yeah. I have to say I haven't studied carefully the way in which race or ethnicity as a biological concept are used in other countries. I know generally about varieties of approaches like France that does not allow for racial categorization in scientific research that's funded by the government or in government records, and Brazil that has a broader range of racial categories. And I'm also somewhat familiar with the insistence in Japan of using subjects in clinical research who are Japanese on the theory that the Japanese are biologically distinct. I think what's interesting about that is that it contests then our view in the United States of Asians being a uniform, separable racial group. The Japanese who are viewing clinical trials done in the U.S. that treat all Asians as one group object to that idea. So for one thing, I think when we look at the way race is defined around the world today and historically, it confirms the idea that race is a political, invented grouping. It is not natural. If it were natural, then scientists around the world should be able to agree on what these categories are, and they don't agree on them, and never have. So I think that's an important perspective, the international global perspective. On the other hand, I think it's also important to note that U.S. categories of race have a global reach, not just U.S. categories, but the history of the European invention of race to colonize and enslave people. That history has an impact around the world, and it's important to, I think, recognize the damage that it's done throughout the world, even though there are clearly, as I said, differences in approaches and definitions. And then I think it's also a very interesting and fruitful area of research and advocacy to do more investigation of the meaning and definition of race in other countries. And I think that this issue of the way in which biotechnology has the potential to reinforce unjust hierarchies of power by reifying notions of biological sameness and difference. That is, I think, is a global question. I personally have been focused mostly on the United States, but I would be very interested in working with people in other countries to address the way in which these definitions are playing out politically within their countries or as a global project. I think that's very important. It's something that I would like to do more work on in the future.
Would you say that because science and technology do have this special power in society to speak nature, to basically represent what nature actually is, does that create a need or necessity for politics? Like, precisely because of the power of these practices and discourses and institutions, that itself makes it an extremely important locus for politics. It seems like that is one of the motivations of your work.
Yes, you're absolutely right. I contest the view that science is somehow isolated, immune from politics, and not only politics, but also the market. This is also some of the pushback I've gotten is claims that I falsely believe that scientists are affected by politics and that this research being done on race is completely free from any social values, ideology, or political motivations or financial incentive. Of course, we know that is not true. Science and politics have always gone hand in hand. You cannot separate the two. as you said, David, I think you're absolutely right, that science, in fact, by its very nature, its very authority in being able to give an answer to what nature is, and also to explain phenomena as natural, that is a way of explaining social and political phenomena, conflicts, inequalities. Scientists have been hugely instrumental, essential to the perpetuation of the view of race as a biological category in order to justify racial inequality and oppression and hierarchy and privilege. So we know historically science has played a role in this very issue. And so it also can play a role in, I think, in dispelling these myths. That's why I say I think it's important for scientists to be involved, and many are involved, but more should be, in this inquiry, in this struggle to create a biopolitics that furthers social justice, recognizing that science cannot stand back and say we have no role in it. Science has a role in it, and I think what I and many others, including the Center for Genetics and Society, wants to do is ensure that the role science plays is democratically governed and directed toward greater human equality and justice, as opposed to reinforcing the very deep social inequities that continue in this country and around the world.
My guest has been Dorothy Roberts, who is a professor, the Kirkland and Ellis Professor of Law at Northwestern University. It's just been a pleasure speaking with you, Dorothy. I want to just also tell our audience that the next Talking Biopolitics seminar will be with Harriet Washington, interviewed by Lisa Ikemoto. I will turn over to Marcy. I apologize I didn't get to every question, but hopefully maybe we'll get them up on our website, and maybe Dorothy would be able to say a few things to each question. We'll see. I just made that up, so I'm not volunteering on Dorothy. But in any case, let me turn it to Marcy and thank Dorothy one more time.
Thank you, David, very much. Go ahead, Dorothy.
Oh, I was just going to say thank you, David, for being a great host and interviewer. I enjoyed it, and I would be happy, Marcy, to answer any remaining questions online or however you tell me I should do it.
Great. That's terrific. So thank you to both of you, Dorothy and David. That was really, really interesting. And thanks to everybody who is participating. I want to echo David's thanks for your questions and apologies that we didn't get to all of them. 2 quick reminders to reiterate David's about the next Talking Biopolitics event on May 8th. We'll be sending you an email with a link to that. It's also in the email you got about today's event. And the second reminder is that if you want to find out more about the Tarrytown Meetings, you can go to the CGS website. And finally, we want to welcome any suggestions you have for future Talking Biopolitics conversations, and also any other kinds of feedback you'd like to give us. So thanks, and signing off now at 2 o'clock. Bye-bye.